Let's talk about vitamin D and its role in human reproduction. It's a hot topic. And there's no question there's a worldwide epidemic of vitamin D deficiency, and about 40% of pregnant women are vitamin D deficient, as defined by blood levels less than 30 nanograms per mil. And the reason I mention the units is because sometimes you'll see it expressed by different units, so be careful what you read and what considered normal and abnormal. 80% of vitamin D will come from sun exposure by conversion of the skin, in the skin, to vitamin D, and 10% come from diet, and therefore we need to have supplementation somehow. The role of vitamin D in vitro fertilization outcome is uncertain because there are conflicting reports. So it's not clear if supplementing vitamin D in people undergoing in vitro fertilization or people going through fertility treatments will improve fertility. The role in pregnancy and lactation is a little bit more defined, in the sense that vitamin D is important for calcium metabolism, and deficiency of vitamin D in pregnancy increases a variety of issues like increasing preeclampsia, gestational diabetes, miscarriages, preterm labor, fetal growth restriction, and even bacterial vaginosis. So the current guidelines recommend to take 400 to 800 international units of vitamin D a day, which may not be adequate. Others say 800 to 1,000 international units are adequate to achieve in pregnancy adequate blood level. Some people, however, recommend higher levels, up to 4,000 international units a day. And we know that it might be excessive for some, but usually there are very minimal side effects. So what do I recommend? I think when you're pregnant, when you're trying to get pregnant, levels or taking supplementation of 3,000 to 4,000 vitamin D3, which you can get over the counter, is reasonable. Another way is to check your vitamin D blood levels and act accordingly. So vitamin D in human reproduction, uncertain role in infertility, in pregnancy, very important. Thank you.